morning to everyone. My name is Mithradevi. I am working as a nursing tutor in E.S College of Nursing. Today we are going to see about short management of first aid. As a first aid, generally what are the some causes related to will come. First thing is asphyxia. Okay, asphyxia is a serious emergency situation which results from inadequate oxygen supply to the body, or in other words, as a result of accumulation of excessive carbon dioxide in the body. This is called asphyxia. And what are the reasons why the asphyxia will comes? Okay, so what are the reason means due to drowning and choking, collapsed lungs or chest compression, gas poisoning, strangulation and suffocation. These are the situations we can handle in emergency as a causes will comes for asphyxia. We move on to other reasons means next is high altitude, deep sea diving, cyanide poisoning, tetanus infections, head injury, stroke, asthma. And these are the other causes of the reasons will comes. And due to the asphyxia, what are the signs and symptoms will comes means noisy and difficulty in breathing, cyanosis, distended neck veins, disorientation, unconsciousness and convulsions may occur sometimes, and patients goes to sometimes rapid pulse, shallow breathing, dark spots in front of the eyes and loss of the vision, cessation of the respiration. These are the signs and symptoms of the asphyxia. And complication finally it goes to sometime coma, brain death and death also will comes. And what are the first aid management due to this situation in emergency? What it means first aid? Before the ambulance reach to the situation, we have to give to the first aid to the situations. That is called first aid. And what are the aims of the first aid during this situation? To restore the victim breathing and maintain the respirations. Okay, how to restore the victim's breathing and maintain the respiration? Sometimes the patients have been conscious and are unconscious with the pulse and breathing means we have to put a Fowler's position and ask someone to immediately call for emergency medical services. That is means what? We have to call a ambulance, whatever the near it will be reach in the on time, and remove the what causes of asphyxia. Why the asphyxia will come? What are the reasons we are seen before that? That you have to remove the causes of the asphyxia. This is the first aims for the first aid management. And choking. If it is a situation, choking means what we remove the object by the abdominal thrust. Okay. For adult we have to give the abdominal thrust, and pediatric means we have to give the slapping method of the abdomens. Okay. Next, drowning. Drowning in the water. Remove the victim safety from the water. First we have to take a victim from the water. If it is a drowning means suffocation. Due to more of the carbon dioxide as inside the area. Remove anything or object which may block the airway. That is called suffocation. Next, gas poisoning. Move the victims to the fresh air. Okay, where the fresh air will comes. Okay, so suffocation and that area we have to remove that places. Next, the asthmatic attack. Help the victim to attain the Fowler's position. If the asthma patients have, sometimes some patients will using a spray means we have to ask them to take a sprays, or otherwise we have to put the patient in a Fowler's position nearby the floor. Okay, these are the aims of the first aid. And general, what are the steps we have to do? General steps of the all first aid is make the victim lie down comfortably on the floor in the prone position, and check is her clothing and loose the tight clothing especially near and around the neck. We have to loosen the cloth and especially near the around neck and his body. If the victim is room, ventilate the room of the by opening the windows, turning on the exhaust fan. If the victim is lied on the suffocated room means we have to open the windows or make a ventilated fan to the patient victims. Next, check the airway breathing circulation. Next, we have to check the ABC. If the victim is unconscious means we have to start the CPR. If the victim is having if three things is absent, that is means carotid, first you have to check the consciousness, next you have to check the carotid pulse, and next you have to see the respiration. If the three things is absent means you have to call the ambulance and start the CPR. Next, drowning. Drowning if the water, a death caused by being underwater, not able to breathe. or otherwise a condition when water enter the lungs causing asphyxia. These are the definition of the drowning. Okay. So what are the reasons how the drowning will happen? Drinking alcohol while boating and swimming, and blow the head on seashore when in the water. Okay. So inability to swim also we have to drowning, and leaving a small children unattended around the bathtub and pools. Okay. So these are the causes of drowning will occur. And if it is occurred means what are the signs and symptoms will come? Vomiting, blue skin of face and lips, pale appearance, cold skin, chest pain, cough with pink frothy sputum, lethargy, restlessness, no breathing. And the aims of the first aid to ensure a open of the airway to restore the breathing. This is the first main management for the drowning. Okay, what are the general step we have to do? Remove the casualty from the water as soon as possible. We have to remove the victim from the water as soon as possible. Do not be a hasty and ensure your safety first, and you have to be safety first you also. Do not endanger yourself also. When the drowning sees the victims in the water, suddenly we think and we have to save the victim, so we people also go and swim in the water. If you know the swimming means you have to put, otherwise call for other help. Okay, that is only they are telling. Do not endanger yourself also. Lay the victim on his back, remove the tight constructed clothing near and around the neck and chest, waist. Check the victim is breathing, put him a recovery position. If the victim is unresponsive, then we have to follow DRSABCD action plan. They are shortly we call for drowning DRSABCD action plan, which is described we seen below. What does mean DRSABCD? D means danger, R means response, S means send for help, A means open the victim, B means breathing, and we see the D means what? Danger. Ensure the safety of the self, victim and other. First we have to come out the situation from the danger situation. Next, response. You have to check the response. Call the victims nearby the ear. Shake and squeeze the shoulder. If there is a response means make the victim if the victim is in response to you means you have to make the victim in a comfortable position, that is a fowler's position, sitting position. Check the injuries if any, or otherwise you have to monitor if what are the response the victim is showing to you. Next, if there is a no response means follow the next step. Send for help. Ask for one time to call the ambulance. If you check the response, there is a no response means you have to call the ambulance, or otherwise if you have another person means ask them to send and call the ambulance. Next, O, open the airway. Open the victim mouth if the foreign material is present in the inside means. If it is inside or not we have to say. Next, place the victim in a recovery position. Clear the airway. Open the airway by tilting head with the chin left. Okay. Next, breathing. Check for breathing. Look, listen and feel. Okay. So these are the breathing. If the victim is in normal, so all things, the patient is consciousness and the patient is in responding to you, and it is he or she is a normal means, place the victim in a recovery position. Monitor the breathing, whether the patient is breathing or not. You have to monitor in the chest area. Manage the injuries. If anything is bleeding means you have to put the pressure in the bleeding area for bleeding management. Next, treatment for shock. If the victim is breathing is not normal, so conscious and unresponsive, the patient is not breathing without a pulse means you can call the ambulance and start the CPR. And next, defibrillation we have to see. Next, hanging or strangulation we can. Hanging means was suspension of the body by noose around the neck. Something is that is called hanging. This is also one situations. And strangulation means constriction or squeezing around the neck or throat. Okay. So what are the causes? Why the strangulation will sometimes the murder also will come. Next, suicidal tendency. Next, accidental by the tie cloth caught in the machinery. Sometimes when you are traveling in a bike also, some peoples will hang in the cloths in the nearby, the accidentally tie and the cloth, or sometimes machine also. Manual choking and postural asphyxia also will come. And what are the signs and symptoms if you occur? Means a constricted object around the neck means And observe the victim neck markers can be seen around the neck. Okay, next congested face, where is the vein can we see. Next you have to see the whether the face the congested veins, or you have to see tiny spots on face. Okay, sometimes the tiny bleeding spots are near the epidermis area. Next tiny spots in the wild portion of the eye. Next difficulty in breathing, impaired consciousness, cyanosis and death also. Next, what are the first aid management for hanging and strangulation without any other thought when seeing a victim in case of hanging? This situation you are hanging means immediately remove and construct it around the victim's neck. It may interfere with the breathing. While doing so, support the body if it's still hanging. There is a chance of the spinal injury. That is the main chances of spinal injury. So do not remove the casualty unnecessary. Instead of leaving the chin, this will give the victim a better airway. Do not destroy or interfere with any material on spot, as it may be a part of evidence for the police also. Next, lay the casualty on the floor. Check for manual choking. If present, continuous first aid for choking the victims. Open the airway and check the victim breathing. Look, listen and feel. That is called LLF. If the victim is breathing means place the client in a recovery position until the ambulance arrives. If the client is not breathing means then immediately prepare to resuscitate. Next, poisoning. Okay, so there is so much of poisoning cases are comes in the casualty, we can see in the society also. It occurs results of the exposure of the harmful substance. This can be led to breathing in, swallowing, ingestion, injected or by the means of skin containing poison. And what are the causes of the poisoning? Drug over the counter, detergent and cleaning product, insecticides. These are the sources of comes poisoning cases. Certain foods, carbon dioxide gas, chemicals, paints, indoor-outdoor plants, enmity, suicidal attempts. And signs of the symptoms in irritability, seizure, bluish lips, chest pain, difficulty in breathing, confusion, dizziness, drowsiness, palpitation, numbness, and tingling, nausea, vomiting, abdominal pain, diarrhea, loss of appetite, cough, double vision, skin rash, burns, unusual odor from breath, stupor. And what are the types of poisoning cases are? Ingested poisoning, inhalational poisoning, carbon monoxide poisoning, aspirin poisoning, food poisoning, acid poisoning, alkali poisoning, organic phosphate poisoning, kerosene poisoning, datro poisoning, alcohol intoxication. Okay, what is mean ingested poisoning? What are the chemicals sometimes you are getting? That is called ingested poisoning. And collect the ingested poisoning, collect the history from the type of the poison is taken the victim. Check and monitor the victim of the airway, breathing and circulation. If the victim is not breathing, does not respond, then you start the CPR. Make sure that the victim has been poisoned before giving any treatment. Find out the following to confirm the poisoning: labor, breathing, vomiting, burns around the mouth, bad odor from breath, chemical smelling breath. These are the sometimes we seen in the patient ingested poison. Identify the poison if it is a possible, and vomiting is never induced. Okay, if the vomit is not never induced for this poison, do not ask the victim to vomit unless the cause of the poison is identified. Unless you are not identified the poison, not supposed to induce the vomit. Call at poison control center. Follow the instruction on phone. If the victim is vomit, clean the victim mouth. Provide a comfortable. If the victim is in conversion, provide first aid as per the conversion. Ingested poisoning, then lie the victim on the floor with the head turned on the one side. This position, the end of the stomach where you enter the small intestine straight up. This position, gravity will delay the poison advance into small intestine where absorption into the victim's circulatory system is faster. Secondly, it helps to prevent a breathing foreign material into lung if vomiting begins. Never leave the victim alone and seek the medical immunity. Caution: never ever give a milk or water to dilute a poisons. Okay, unless advised by poison control. Fluid may dissolve a dry poison, that is a tablets capsule more rapidly and fill up the stomach, forcing the stomach contact, that is a poison, into the small intestine where poisons are absorbed. Inhalation poisoning. This you seen in the major of the factories and carbon monoxide poisoning is okay. So what is mean inhalational poisoning? Call for help. Okay, check the site for your safety. If it is a safe, Rescue the person from the damage of the gas, foams and fumes. And if possible, open the door and window to remove the fumes. Next, check the victim: airway, breathing, circulation. If three things is absent, presence without a unconsciousness, the absence of consciousness, pulse and breathing, means you have to start the CPR and seek a medical help as soon as possible. Yes, thank you.